We're done. No, nice thing. Yeah. All right. Good morning. Let's go ahead and get started. This is our first grand rounds of the academic year, and I see everybody's still having a little trouble getting used to the new schedule. So this morning we're just going to do a department meeting, give updates of what has been happening over the summer, and then we have a couple of our department vice chairs, as well as what's not on here is actually Vanita is also going to get an update on the work that she's doing on wellness. So I thought I'd just start by talking about the new people who will be joining us across the different divisions. In general surgery, these all might be quite familiar faces, starting with Yulia Zak. She is a graduate of our residency program, did her MIS fellowship at Mass General, and now will be starting back here joining the MIS group in December. And she will be replacing Omero Rivas. Kim Stone will be graduated from here 2 years ago, just finished her breast fellowship at UCSF, and will be joining us primarily practicing at Cancer Center South Bay. And Dr. Carol Liebert, who a few months ago was a chief resident, is now junior faculty at the VA in general surgery. And vascular surgery, again, a couple of familiar faces. These are both also products of our program. Elsie Ross is a graduate of the Integrated Vascular Program, joining us as an assistant professor, and Mike Skrogi is a graduate of the Vascular Fellowship and also joining us this July. In pediatric surgery, two surgeons who have been in practice at Oakland Children's, but working for us at John Muir, which is one of our joint venture outreach sites, have officially joined the faculty as of about a month ago, and this is Tom Huey and Wendy Sue. And the way that Dr. Dunn has set up pediatric surgery now is that all the faculty will be rotating here on our campus for some portion of their tour. And in plastic surgery, we have one new hire, Dr. Matt Murphy, will be joining us as a clinical assistant professor. He's a reconstructive surgeon. Since we last met, we've had a few promotions and a few appointments for the department. I want to announce Sabine Giroux was promoted to professor in the Division of Plastic Surgery, and Claudia Mueller was promoted to associate professor in the Division of Pediatric Surgery. And I don't see either of them here to congratulate them, but I'm very proud of their accomplishments. Vanita Chandra has taken over a new role in our department as the Department Wellness Officer, and she's our liaison to the wellness initiative that's led by Tate Schoenefeld, who is the Chief Wellness Officer for the health system. Dr. Schoenefeld will be giving us grand rounds in December, but Vanita is going to give us an update a little bit later this morning and talk to us about what some of the plans are really to address some of the issues that face the faculty in terms of not making our jobs as fulfilling as they could be. So we'll hear from Vanita a little later this morning. And Andy Shelton was officially appointed the Chief of Colorectal Surgery. Dr. Mark Welton left about a year ago. Andy was serving in the interim role, and Dr. Kababu appointed him as permanent Chief of Colorectal. So I don't see Andy here either. He was? All right. Well, congratulations to them all. With sadness, Amanda Wheeler has decided to leave Stanford. She'll be joining PAMP next month, so she'll be leaving Stanford at the end of this month. And I know we're actively looking for someone who will replace her. So lots of other exciting acknowledgments that have happened over the summer, and a few I think that happened in the spring that maybe we didn't get to the meeting. But Lisa Knowlton was awarded the James Carrico Faculty Research Fellowship from the American College of Surgeons. This is an incredibly prestigious award. So is Lisa here? All right. Carla Pugh was, Carla's here. Carla was inducted into the American Institute of Medical and Biologic Engineering, so congratulations, Carla. That's a huge honor and recognition of the importance of your work to the field. Todd Wagner was awarded a NIDA grant along with Dr. Keith Humphreys, and Sherry Wren was elected to the Pacific Coast Surgical Association president. She'll be president in 2021. So let's give a round of applause to all those folks. In pediatric surgery, we have 2 new awards. James Dunn is a co-investigator on a new R01 with Dr. Calvin Kuo. And James Wall just got a really exciting consortium grant with UCSF. It's a $6 million grant that will leverage biodesign to develop devices appropriate for pediatric patients. So really exciting award, and I know that he's been working quite hard on that. And I don't see James here either. So, but congratulations to both of them. And plastic surgery, they had quite an eventful summer. Mike Longaker just received notice that he'll get a new R01 funded, as well as Derek Wan. So those are 2 big grants coming into plastic surgery. And Jim Chang is the president of the American Hand Society, and that meeting will be taking place in September. So congratulations, you guys. And vascular surgery, this last May, Ron Dahlman was elected president, or vice president. He'll be president in the academic year of 2021 at Society for Vascular Surgeons. It's the most prestigious vascular society, so a huge recognition of his leadership in that society. Nick Leeper hit it big on a couple of grants. He is a co-investigator on a Leduc Foundation Award, and he also received a Transformational Project Award from the American Heart Association. And we think Nick may also have some exciting news for us on another grant that he put in, or that was reviewed over the summer. John Harris will be president of the Western Vascular Society, which I think is actually this month, right, September? Yep, so congratulations. And Elsie Ross was awarded the SUS Junior Faculty Award, actually technically before she was faculty. So, so let's give a round of applause to all the awesome things in vascular surgery. And then in transplant surgery, Carlos Escovil's U01 grant was extended for another year, and both Dr. Martinez and Dr. Krams were awarded subawards from the NIH NIAID to continue on in their work. So 2 new grants, as well as an extension brought into transplant surgery. So lots of activity, good news across all the divisions over the summer. I don't see Carlos or either. Okay, great. A couple other things, more hospital-wide. Dr. Rolf Greco was given the Lifetime Honorary Medical Staff Award at the medical staff ceremony last spring. At that time, also Dr. Marty Bronk and Dr. Jim Lau both have received awards for excellence in promotion of humanism. And Dr. Lau and Dr. Studemeyer also received the Arthur L. Bloomfield Award in recognition of excellence in teaching in clinical medicine. So let's congratulate them on those great awards. So everybody see the U.S. News and World Report rankings. Stanford is ranked in the top 10, number 9, which is awesome. And but you'll probably be hearing a lot more about this because our goal is really to be the top program in California, and 3 other California programs beat us out. So there's a lot of California programs in the top 10 this year. And through the new integrated strategic plan, there's going to be focus more on what are some of the things that we need to do to enhance our rankings. So upcoming events, a big one starting actually tomorrow evening is we have the honor of hosting the Halstead Surgical Society. On the slide are 5 Stanford faculty who are members of the Halstead Society. This is a traveling surgical club, and we'll be hosting it this year. Many of the faculty will be participating in the local events program on Thursday morning, and it's truly an honor to host this. And Dr. Wren is the immediate past president of the society. And at the end of this on Saturday, hopefully all of you faculty will join us in the tailgate before the Stanford-USC game. And for those of you who have tickets or got tickets through the department, come join us to cheer on the Cardinals against USC, and hopefully we can reverse the results of the last game in December. At the Clinical Congress, we will be having our reception, as always, on Monday evening. You'll be getting a save the date, and hopefully you'll join us if you're attending the meeting. So it will be from 6 to 8 p.m. at the Renaissance Boston Waterfront Hotel. Just to give you a preview of Grand Rounds and some of our invited speakers this year, and special events that we'll be hosting, I thought I'd go through. We tried to spread them out a little bit more this year. Last year we had a couple that were clumped together. So, and this year we happen to have 2 extra lectures. So every other year we host, pediatric surgery hosts the Crawley lecture. This goes between pediatrics and pediatric surgery. And pediatric surgery has invited Dr. Shimada, who is a pathologist at Children's Hospital of LA, who will be speaking on pediatric tumors. For the Ignatius lecture, we invited our new neighbor to the north, Dr. Julianne Sosa, who took over a chair at UCSF this past spring. She's an endocrine surgeon, and she'll be joining us. As I mentioned earlier, Dr. Schoenefeld will be here to give us a talk about what he envisions his role as our new Chief Wellness Officer. For the Solitaria lecture, Dr. Megan Sykes will be joining us on behalf of transplant surgery. Education lectures, Dr. Richard Resnick, and that wraps up this calendar year. In January, Dr. Reshma Jagsi will be giving our diversity lecture. She's a faculty in radiation oncology at University of Michigan and holds I believe a PhD, but if not, a master's in bioethics. For the COVID's lecture, which is also a lecture we host every other year, we go back and forth with the Department of Medicine. We've invited Dr. Jeff Matthews, who's the chair at the University of Chicago, to join us. For the Chandler lecture, Dr. Mark Levitt. Again, this is another pediatric surgery lecture. And then finally, we moved up the Holman lecture from June to May because there's so many other end-of-the-year things going on. And Dr. Melina Kibbe, who's the chair at the University of North Carolina, will be our Holman lecturer this year. So those are some of the upcoming highlights for our Grand Round series. And finally, I just thought I'd talk a little bit about some of the philanthropy updates that we got and gifts that came into the department over the summer. So first one is the Manami Fund. This is a gift to the Division of Plastic Surgery made by a former trainee, really to honor Dr. Don Laub, who was Dr. Manami's mentor. Dr. Laub founded what is now research, which is really to, and I'm not research, I'm blanking on it. Is it research? Research, yeah, okay. It was Interplaps, it was before that, but to really improve the global plastic surgery expertise. And so this fund will support 2 plastic surgery residents to travel on an international elective each year. Jill Helms received 2 awards. She got an award from somebody who was inspired by her work and made a gift to her lab to further support her research endeavors, as well as her high school program that she runs every summer called the STARS program. Another grateful family whose child participated in that program gave $200,000, $100,000 to support Dr. Helms and $100,000 to the department that we're using to support medical student and resident activities. And trauma surgery received a nice gift from a family from a young adult bicyclist who was injured when a freak accident happened and a tree fell on him. He was brought immediately here to Stanford, and his family was quite grateful. Here you can see the picture of the bike underneath the trees. So they made a $500,000 gift to the Division of Trauma Surgery, or the section of Trauma Surgery, and then $100,000 to the department. Again, that we'll be using to help support resident and student activities. And finally, we got a $8 million bequest from one of our surgery faculty. Has decided to, they don't have heirs, and their estate will come to Stanford, the majority of their estate. 50% will come to the Department of Surgery, and 50% will go to the School of Medicine to assist students and trainees. So incredibly generous gift that we hope that we will not use for quite a very long time. So And I think, I hope all of you have really kind of enjoyed the updates, what's going on a more regular basis from Rachel Baker. I can't say that the impact that she's had in our department and really helping us celebrate kind of in real time things from bursts to grants to awards to papers and things like that. And so whenever you have something like this, make sure we know about it. Sometimes they trickle up to me and I send them to Rachel, and she gets it out there. She sometimes includes it in the newsletter, puts it on the Facebook page. She's been coming into the operating room and taking pictures of our surgeons. And so please, anytime you have something that's noteworthy or just of interest to your colleagues in our greater professional world, we're really just trying to get out there all the great things that are happening here. So these are all the different ways to get Rachel involved. And if you have ideas, just go meet with her. She'd love to hear some thoughts. And I think she's especially looking for some YouTube channel video type material. So that's the end of my update. And I think next Dr. Gertner is going to come and talk about the new Faculty Grant Seed Award Program.
Thank you. Thanks. So let me get out of these. Yeah, so talking today a little bit about the seed grant program that we first kind of discussed at the research retreat in May. The reason it's important is that it's time sensitive. The deadline for applying for these grants is coming up at the end of this month. You know, one of the things that came out of the research retreat, among others, was the need for funding, essentially to prime the pump for junior faculty and for all faculty to start new projects and just to gain preliminary data so that we could get larger grants in the future. So the seed grant program was endowed by Mary and the department. All Department of Surgery are eligible, including affiliated faculty at the VA and other institutions. Trainees are not eligible for this, although the faculty can select to apply for a professional development resident funding, but it needs to come from the faculty member themselves. Total amount of money in this first round is $250,000, and you know that will be parceled out in, you know, again, you have to come up with a budget anywhere from $10,000 to $50,000 per grant, and we'll, you know, fund as many as we can that are meritorious. Funding will need to be used within 12 months, and importantly, the application is due September 30th. This was sent out. This is the template for the grant was sent out on August 8th. It'll be sent out again today. It should be a relatively straightforward grant application. It's a 2-pager, so take a couple hours at most of your time to take care of. You know, again, the pieces of it are pretty straightforward. You know, basically, the most important thing is to you know, demonstrate the significance and importance of your work, what you're going to do, how you're going to spend the money, and then all these applications will be gathered up by midnight on September 30th. The Research Oversight Committee will review these in the beginning of October, and hopefully all the funding will be available by November 1st. And again, this is not just for basic science. This is for every type of research, health services research, clinical trials, technology development, education, global surgery. It can fund virtually anything. You just have to tell us what you want the grant to go. It can go for, you know, hard equipment, reagents. It can go for personnel, consultants. It can go for engineering, you know, part-time FTEs if you're doing a technology project. These are the people that will be deciding on ranking the grants, and we have a wide variety of people from all the different divisions of of general surgery, and all the different types of work, including technology innovation, global surgery, education, research. So we've tried to make this a very fair process. Please, if you have any questions or concerns, send me an email, and we can always add more people. It gets a little bit unwieldy when you get a study section larger than this, but this is who will be reviewing the grants. And the criteria just for assessing the grants themselves will be, significance in the field of interest, the innovativeness of the approach, just the rigor and scientific merit, how this is going to help move your program forward, may lead to publications and to external grant proposals. And it's really important that somewhere within the 2 pages you explain how, because certainly $50,000 doesn't go all that far. So we'd like to know within the context of your grant application how this would lead to potentially applications for larger grants, including NIH grants or other foundation grants. So it's important to kind of contextualize this amount of funding and how it's going to lead to hopefully your ability to apply for larger grants. And that's really it. I think the most important thing is you'll get the application and template again today. It's due September 30th, and hopefully we will be awarding these by November 1st. If you have any questions, please feel free to reach out to myself or Arden, and for the forms and logistics, Julia will be sending out the grant applications today. So. With that, I'll just open it up to any questions anybody might have about the program itself. And, I think the important thing is it's due in 26 days.
Jeff, if somebody needs like a piece of equipment so they can do new experiments and that's what they need the budget for, those things that you would consider?
Yeah, of course. Yeah, I think anything really. It's meant to be enabling, and if there's a frictional bottleneck that's preventing people from going to the next level, that's what we want this funding to go for. So it can go to to hire personnel, it can go to equipment, whatever. I think it just in the 2-pager, there's the last section is budget and budget justification, which should be 3 or 4 sentences. I think in there that should be like why this is going to be a really important thing for advancing whoever's program it is. All right. Do you envision just doing this once a year, or maybe expanding and doing call for grants like twice a year or so? Yeah, I mean, I think. Have access to money at different times. Yeah, I think certainly we could do it more than once a year. I think we'll see how if this is oversubscribed. I think that'll make a compelling case for doing it more often. If we get 20 or 30 of these, I think that'll tell us that there's a pent-up demand. If we get 2, then maybe not. So I think it really depends. I think we're going to play it as it lies and see. I don't know if Arden's here. Oh, do you have any comments about that? Right. Great.
Thanks, Jeff. And that was, I think something that we heard from the research retreat that really, in terms of faculty research, was something that we had access to a program like this would hopefully really be able to leverage it to get other awards and other extramural funding and just give people the access to resources that they needed to get a project up off the ground. So thank you, Jeff and Arden, both of you for your leadership. Next is Dr. Korndorffer is going to give us an update on some of the things going on in his new role as the Vice Chair for Education.
There's certainly a large number of things going on in each of the divisions with respect to education, but what I'm really going to try and focus on are those areas which encompass all of the department itself. So really 3 areas I'm going to focus on. One, some changes with respect to the Goodman Center itself, talking about resident assessment, and then finally a little bit about the new resident leadership course itself. So as far as the Goodman Center is concerned, this is where the refrigerator used to be about 4 weeks ago at this point in time, as well as a conference room. The whole goal here, really, you think about it, is create the Goodman Center really as a true department resource, meaning whether that be general surgery, vascular surgery, plastic surgery, pediatrics, transplant, the like. Example right here, what we've got is we're going to do that in really two ways. One, as far as the residents are concerned, there's some need to have things available immediately without necessarily having to go in there, find somebody to get things set up for you so you can practice on a regular basis. And this is what this space really is going to be. And you can see here the laparoscopic towers are present. And then there's plenty of space available for if there's certain things, for example, that you want with your particular rotation, or for that matter, plastic surgery, vascular surgery set up on a regular basis for people to go in and train on, then these are certainly available. This gives you a little more close-up view itself, and this also includes the opportunity to really get these things out of the area that was the kind of the team training area, and that allows that to be used more readily as well. Another way we're doing that is trying to help you as far as faculty are concerned. There are a couple ways of doing that. Number one is this is set up, as you see on your right, an area we can actually evaluate individuals through videotape, so you don't have to be there the whole time. So then you can review those afterwards to help with their training and assessment itself. Finally, if you have any ideas that you want to use, we've created a very basic curriculum proposal. The whole goal for here is to get you to think through the process, and we're more than happy to help you with this, okay? You come with the idea, but this allows it to be educationally sound throughout the whole process with the curriculum itself, and we'll give you a chance to put things forward. So anything you have as far as they're interested that will help, for that matter, just your rotation itself, we'll be more than happy to proceed through that. The second initiative is dealing with assessment, and one that's going to be rolled out, in fact, in 2 weeks. Here at Grand Rounds is operative assessment, and this is going to be available, again, throughout the entire department. Looking through things, one of the big challenges we have in looking at the past is that the number of operative assessments really are quite minimal. In fact, barely make it to the number that we need with respect to the American Board of Surgery, as I'm sure Mark would attest to. And the reason why it's a challenge is, and it is a challenge, it takes a lot of time. Well, this has actually been used for quite a while now, actually the last several years, through a consortium of numerous medical surgical programs throughout the United States, and it's described as it's the Simple app. Really, three main questions, as you'll see here. One is simply the resident sends it to you and then fills out the idea. Number one is what kind of help was given. Number two, how they performed. And then finally, the third part is whether you thought it was a hard, easy, or difficult case. Additionally, you do have an opportunity as faculty to give dictated feedback straight on your phone itself. And then finally, other notes that you want to put down as well that you can remind yourself later on down the line. Again, this will be rolled out. We're having a full discussion of this in 2 weeks, where there'll be people here available and helping, making sure it's on your phone, as well as how to use it and the like. We do have not only faculty champions as well as resident champions to certainly help out as well, and any problems or concerns, again, please let us know. To give you some idea of what you get back, this will give you an idea on your right, or what the resident would see, and again, shows the resident as far as, for example, through the process of what they have had, and then also the attendings get a response as well. And it's kind of fascinating if you talk to the individuals that are around this. What it really is inspired is the attendings help sort of give you your self-feedback of how much you did, whether it's active help, passive help, and the like, or on their own. So this gives you some idea of how much autonomy the resident has, and that really is a big aspect. But what it's really done is this. So we talked about the number of these assessments that are done on a regular basis, and these are just some numbers that they had coming out of it. And if you notice that as far as the program, just an idea is that they're getting about a 70% response rate. The main reason why it's very easy to do, it's basically done within just a couple minutes. And even more importantly is that once you get in that habit, that feedback actually occurs, because even 25% of the time they're getting some sort of dictated feedback, which is where the rich feedback really does occur. So this is an area that we're rolling out again to all the department itself, and this will start taking place again starting in 2 weeks. Finally, talk about the resident leadership course a bit. This is set up particularly for all PD residents. Right now we're just taking the first year PD residents. Next year both the first and second years will be there, because it is a 2-year cycle. What was done is that they all took a 360-degree evaluation on their leadership skills. Many of you guys may have actually received some of these evaluations for the current cohort, and then they have actually received those back. Then from that, we've reviewed those, and then finally there'll be 4 seminars per year on a 2-year cycle. These are quarterly on Thursday afternoon at 4:15. So those of you that are from a lab standpoint, if you would please allow them to get away in time to be here promptly at 4:15. They do know that cycle. They've already got it preset for the entire year from that standpoint. But you see the 8 topics at this point that we'll be going through over the course of time. And this really is interactive. It's not a lecture format, and it really is actively involved in their input more than just simply a lecture itself. Give you some idea of what kind of information they've gotten. And what we used is the Stanford Business School has what's described as a leadership program, LEAP program, which is leadership evaluation and planning. And it starts with a 360 evaluation. And this is actually not an individual. This is the entire cohort. And it's broken down into multiple domains. And each individual also got their personal report as well. And this does give them an opportunity to focus on certain areas that are their lowest scoring perhaps, or for that matter, identifying what their highest scoring as well. One thing I would like to point out, and it's kind of unique, which we've identified talking to the business school folks, is that if you look at the evaluation of themselves, it's actually worse on every single category than not only their manager, their peers, and their direct reports put into place. This is somewhat interesting, and the business school thinks it's like, well, they've kind of changed the idea. They thought surgeons were all a little egocentric, perhaps. So I think we've proved that perhaps the people in the business school may be a little bit more so than us. But in all honesty, this is an area that it's kind of interesting that you think, well, this is a good thing. It probably isn't, because this actually hinders people's leadership abilities if they don't have the wherewithal to understand where they really fit in this whole process. So that really is, if we have any goal over the course of the 2 years, that really is it. Happy to answer any questions.
Sure, we distinguish between EPAs.
Yeah, oh, great point.
Two different apps.
Yes. Right. And the EPAs are focused specifically on, and the reason why I didn't get into that, because of course those aren't crossing over into vascular and plastics and the rest. The EPAs, which are that we have been assigned, it's a national project, have been assigned in trust and professional activities. In general surgery have been assigned 2 areas, and that be laparoscopic cholecystectomy as well as hernia repair. And that also requires a setup with respect to an operative assessment, not only operative assessment, but also assessment in the pre-op evaluation and post-operative care. That is a separate app, and the residents will have a what do you call those things? Thank you, QR codes that you'll be able to flash on and go give those evaluations. You do not need to do both as far as for general surgery faculty. If you're doing one, that's fine. Don't do both for each of those type of cases. But this allows you to actually evaluate any and all cases other than those as well. So you're absolutely right. There's no reason, again, we're not trying to double the work, but as you see the opportunity, you know, even if you just fill out without the dictation, this does start giving information of where the resident is with respect to the other peers, and that gives an opportunity for them to continue to grow. It really starts giving that feedback that we really need. There are some other areas of assessment that we're going to be working with the programs themselves over the course of time, including evaluating and assessing during M&M and the like, but that's a great point.
Jim, is there any part of the simple app where the resident does a self-assessment of how they thought they did on the operation?
Yes, it is. You're supposed to actually, there's supposed to be a fill out theirs as well. So the opportunity then they can evaluate, and actually the nice thing is to compare what they perceive versus what the attending perceives as well.
And is every program going to start using the simple?
Correct. We've got it set up to where it's been taken care of for all of the programs are available. It's available for the entire department. Now, the only thing I don't have right now is, no reason why, is it for the actual fellows themselves, the ones that are postgraduate, that is not actually set up right now specifically through the way it's paid per person. But as we roll this out, if it deems that's actually necessary, then we can certainly modify that.
Should everybody, I mean, are we starting this now, or are we going to wait until the grand rounds?
Oh, wait till the grand rounds. We're going to have everybody come in. That way we'll get set up. There's no reason. In fact, the true rollout start date, I think we would set up to give us a couple weeks of getting everybody's app on their phone and the like, and any questions answered. The actual start date typically will be, intended would be October 1st.
Any other questions? I think the leadership development program for the residents is going to be really an amazing investment in the residents across all the different programs. And I know, are any of the first-year PDs here that are going through it? A couple, yeah. So I'd be really interested to get your feedback in terms of how useful this is. But this is one of the things I asked Dr. Korndorffer to do when he first got here is to develop this for our residents so that we have some formal type of program to train future leaders in surgery, really give residents insight into how they can be the best leaders. And I think we'll be seeing this as they transition out of their PD years and take on their leadership roles within the residency and beyond. So really want to thank you for putting that together so quickly.
And be happy to have anybody that wants to be involved as well. Please let me know. And certainly from the resident side, it will be organic. And certainly there's some things that may not work exactly correctly. And we're going to modify it accordingly to try and make it better each time.
Great. I think, Vanita, you have slides, right? Great. All right. So like I said earlier, so Dr. Schoenfeld's been here, I think, just about exactly 1 year. I think he joined us last September as the Chief Wellness Officer. He's a pediatric hematology oncologist, was practicing at the Mayo Clinic, and actually, you know, probably has done the majority of the foundational work on physician burnout. And particularly among surgeons, a lot of the surveys that many of us have participated in through the American College of Surgeons are some of the data that he's used to describe some of the stresses that really face our profession. And so what I'm really happy and excited about is we're getting beyond describing the phenomenon that we're seeing and starting to see how can we really change this and make interventions here at Stanford. And I'm really happy that somebody with Anita's energy and enthusiasm is taking the lead for our department.
Thanks, Mary. So I guess you all know what my new role is, and it's obviously a work in progress. You may recognize some of the other faces in this slide. These are the other department well-being directors. Every department has one well-being director, and as a council we meet once a month, and we've been working for the past few months just really in terms of just understanding, you know, the issues related to wellness. So we, as department well-being council members, basically report to our respective department chairs, but we're supported by the WellMD program. And can I just have a show of hands? Who is familiar with the WellMD program and the resources that they already have? Okay. So the WellMD program has actually been here and been working for several years trying to focus on faculty and physician well-being in general. Obviously, not many people are aware of the resources there, and so there's been some increased attention, and as Dr. Hawn already mentioned, Tate Shanafeld has been hired. This is actually a big deal. We are the first academic medical center to hire a chief wellness officer across the country, so I do think it's a sign of the importance that the school and the hospital are putting on this topic. And so basically the WellMD Center is sort of guiding us as well-being directors for the various departments. I'm getting some great help personally within the department. These are our wellness committee within the department, and I'm very, very thankful to each member. As you can imagine, our department is one of the larger departments within that list of departments, and so trying to just really have a good idea of what's going on throughout the entire department is a little bit challenging as one individual, so I've sought help. This is a general sort of MD, sort of vision for the factors that affect wellness and professional development. And as you can imagine, this is a big, challenging issue that affects different people in many different ways. And I know we've had some talks in the past about wellness, and it's just been kind of like, look at how big of a problem it is, and how do we fix it is the challenge. So addressing all of these things, I guess, is a way to fix it. You can imagine it's impossible to address all of them, but we are going to try to tackle a little bit of each aspect, the culture of wellness, personal resilience, and efficiency of practice in various ways. And my next step is to try to get a better sense of what are the major issues within our department You may have already seen the emails requesting your participation in some process improvement focus groups. We've already had one. Thank you to the people that participated in that. And we have 3 or 4 more coming up. And I really just want to hear. This is just a forum to express your questions and issues related to wellness, so we can have some data and some information about what relates and what matters within our department, so that then we can identify well-being improvement topics. The other upcoming thing is a peer support breakfast session. So we'll be putting together 3 or 4 person small groups. These are not meant to be sort of added responsibility, but meant to be a resource. This is excused time from time that you're already, expected to be here. So it'll be once a month meeting during the late OR start on Monday, paid for by the department, and you'll be hearing more details about who your group is and how to go about setting that up soon. So I'm going to stop there and see if anyone has questions, but really beg all of you guys, please participate in these focus groups. It really makes a difference if I can actually hear from you guys, so we can focus on what actually matters for our department.
Any questions now for Dr. Chandra? So I hope that the faculty will participate in some of these focus groups, because I think really, I can think of, what might help. Anita can think about what might help. But really, what we really need is some feedback. And we know it's going to be different across the different divisions. It's going to be different across ranks, outside commitments and stressors that people have. And, what are things, small things, big things that we need to hear about? Do we need more scribes? Do we need more help in different areas? And also across the different sectors. So, because we know if you, aren't, can't be your best self at work, it's going to impact patient care, it's going to impact resident training, and all your total fulfillment in your career. So I really look forward to watching what comes out of these focus groups, and what we can do as a department to really support you in doing your work. And I think the other exciting, I think you saw for the general surgery residency, roles that Monica Du is going to take on is the Associate Program Director for Resident Life, and really excited for some of the ideas that Monica has in that role. And I know with her close work with Dr. Korndorffer, things that we trial in general surgery, I think, could be spread across the other programs too. So really recognizing that we're not just here punching a clock and doing work, but that our work is our life and our life is our work, and we need to find a way to those are the main things that I have for department updates over the summer. I hope everybody had a fantastic summer. It's great to have all the new residents and fellows here, the new faculty have joined us. We've got a great academic year coming up and lots of exciting things. Any announcements from anybody in the room? What's that? Oh, you have a cough? I'm sorry, I forgot cough. Sorry. Okay, then I'm down. Sit back down. Oh my gosh. Sorry.
I'll make it quick.
Sorry, I got ahead of myself there. One more thing on quality. This is going to just add to your burnout.
Okay, I'll try to make this quick. Just providing updates for our metrics, really focusing on the Improvement Capability Development Program. For those that aren't aware of it, that's a program really from SHC or the hospital side to engage faculty, to provide incentives for departments to drive quality improvement, essentially. So looking at fiscal year 18, which we just finished, we had 3 asks from the hospital. One was to put a plan in place, which we did. That's really identifying a physician improvement leader. That was Matt Mill, now myself, developing a quality council and so on. Take on an improvement project. That was that .RCC phrase, right? Improving clinical documentation that we've been tracking all year. We had a target of 50%. We made that target. We're averaging about 80% now on discharge. The last is a Vizient global metric we've been looking at. When they chose this metric, we were ranked 77, I think, out of 107 organizations. We're now doing better. We're now 12 out of 97 organizations, largely due to improvements in mortality and safety. And as Mary pointed out, there's some areas where we're still going to focus on. Efficiency is a big one for this organization. That's really based on cost indices and length of stay. So that's one of the big things that we're addressing in the integrated strategic planning for this year. For the upcoming year, we have 3 areas that we're focusing on, or that we've been asked to focus on. Quality improvement infrastructure, right? So again, developing infrastructure to support continuous quality improvement, as well as promote organizational alignment around shared initiatives, that are priorities. That goes back to, again, the strategic plan for the organization, making sure our initiatives are well aligned. Improvement projects, we've been asked to select 2 or 3. We have 3. I'll go through them in just a moment. But again, to be successful here, we have to be successful in at least 2 of those projects, or at least 1 that's considered high impact. And the last piece of this is faculty development. They're supporting faculty development, which is specific to quality improvement or leadership training at Stanford. So to address all 3 of those, the first is the infrastructure. Just some minor changes that have been made, or tweaks to the Quality Council. We're slightly more inclusive now, really in an attempt to create better alignment. So for example, the UBMDs were not as well engaged. The UBMDs, so medical directors for those units that are listed there, are all tasked with doing quality improvement initiatives. We're trying to engage them and align them now by incorporating them into the council. The Resident Safety Council, so Joanna, I think, is the only member of the Resident Safety Council. She is now invited to participate in the Quality Council and in some of the SHC meetings. One comment there, you know, and this might be really for those in professional development. If there are residents that have the time or the interest and would like to participate in some of the organizational meetings, let me know, or within this infrastructure as well, let me know. The purpose of this council is to review, we review our metrics in terms of the Vizient data, so the quality metrics. We look at PSI fallouts for ARC data. We review all the safes, the M&Ms, and that really also drives our monthly department-wide M&M. For the 3 initiatives we chose for this year, the first is around patient experience. It's value-focused. It's really looking at trauma patients. It's a whole continuum of care, so we're looking at the clinic as well as the inpatient side. In the clinic, we're looking to drive our likelihood to recommend from 65% top box to 79.7%. That takes us from 3rd percentile, where we currently are, up to just over 30th percentile compared to general surgery. On the C2 side, our HCAHPS, likelihood to recommend, we're looking to increase it from 79.3 to just over 82%. I should point out the physician leads here are Kristen Stoudemire and Tim Browder, and these are very big teams supported by several VPs, NPs, and so on. So that's our big initiative. The second initiative is mesh consolidation. So we may all hear about this to some degree. Currently, Stanford has over 40 suppliers, vendors for mesh. That's more than pretty much any other organization. Our spend is about $2.7 million. That puts us at the 89th percentile, meaning that 89% of other organizations participating in Vizient pay less than we do. And that's, again, because we have so many vendors. So Arash is taking this on, and he has a team, and will engage many of you. And he's tasked with trying to consolidate here, trying to decrease us down to less than 10 vendors. We think there's probably a $300,000 to $400,000 opportunity there for the organization. I should point out this is part of the Cost Savings Reinvestment Program, our CSRP. So a portion of those savings will come back to the department to support research or education. The last initiative is telehealth, and this is really leveraging what we can do now in Epic for these telehealth visits. Two things here. One is access. It may improve our access to clinic. The second is really, and this is probably primarily the most important one, is patient experience. So again, we're supported by those departments, patient experience as well as digital health and operations. Andy Shelton is leading this initiative in the Cancer Center. The last piece I wanted to address was the faculty development. I don't know how many people are familiar with these programs, but it's Write or CELT, and they're pretty specific about that. They would like some faculty to go through this, to embed some common methodologies in how we learn. A summary of the differences here. The CELT program, that's clinical effectiveness and leadership training. It's a much bigger commitment, but I want to point out is that focuses on both leadership training and quality improvement. I would really point out the outside speakers are very good, right? So you have Brent James, for those that know who Brent James is. You have Michael Porter's team coming here to address value in healthcare, if that's an interest of yours. And we have Val Elstead and others that teach on leadership, adaptive leadership skills, and so on. So for physicians, for faculty, I would recommend that if you have the time. It meets, well, it's an all-day commitment. It's off-site at the Quadris. That's up Sand Hill Road, so you can't be going back and forth. And it's every other week for 10 weeks, so 10 lectures. There's also the Write program, which I've listed here. That's just quality improvement. It's a scaled-down version with video lectures. It's just 2 hours every other week, but it's also a 10-week course. Both are project-based. You need to have a project. So if you have a project you're working on, it will supply you with the resources. There's coaching involved. It's one approach. In fact, I think Natalie Korolchik, Natalie, you may be going through this for C. diff, at least the right component of it. So I'm just putting it out there for those that may have an interest. The fall actually is filled up now, so starting in May, you have the spring cohort. If people are interested, let me know. So just to summarize, in terms of our targets for 2018 fiscal year, we've achieved them all. For 2019, again, some changes to our quality council and that infrastructure, the 3 projects I listed, and then again, I just want to mention there's the opportunity to participate in Right and Salt.
But opportunities for the residents get involved. You're not done yet.
Okay.
Opportunities for the residents get involved in patient safety initiatives, because I know that a lot of them have great ideas. They're the front line. They really see the things that could potentially make a big difference both in their workflow, but also in better patient care.
Yeah, so we're looking for that. So I can tell you in other departments, many are participating. So there's patient safety councils. There's HIPSIC, where all of these things are reviewed. So if you have an interest and have the time, I would like to engage you in that. Or if you don't have the time and want to bring things forward, maybe we can address them or at least consider them opportunities that we may want to move forward on. So I would encourage you to do that. There are plenty of opportunities. The organization is actually looking for your input. An example is now on the, for 500P planning, there's an advisory council. We're looking for resident participation. If there's somebody that would like to commit the time, let me know, because your input will be highly valued.
And then the other thing, for the faculty who are interested in the SELT and the RIGHT programs, and particularly the SELT program, there's improvement funds that come over at the end of the year from the hospital, and some of those funds could be used to invest in your time, buy down your RVUs. If you come forward with a, really an impactful project that's going to help move the needle, improve patient care. So if you have an idea and you want to participate in SELT, and but you're feeling that, because of other pressures on your time, you'd need some support, come and talk to Dr. Maggio about what your project is, and we'd definitely be willing to look into it. Great. All right. Thanks, everybody, and enjoy the rest of the day.
Good news is, you're still excited, so that's a plus. That was about 1 word.